Many patients ask which ozone therapy is the best. The truth is, there is not a single best option. There are different types of ozone, and all of them have their indications and contraindications. When used correctly, all of them are safe and effective.
In major autohemotherapy, what we do is grab a small amount of blood from the patient, mix it with a little bit of medical ozone, and then pass it through a UV light. And when it's ready, we're gonna return it to the patient again. Because the blood is handled outside the body, we need a little small amount of heparin, so during procedure it doesn't form any clotting. This therapy has a strong systemic effects, helping with immune modulation, inflammation control, and diminish the epoxy tumor environment. However, it's not suitable for everyone. Major autohemotherapy may be contraindicated in patients with blood coagulation disorders, anemia, recent surgery, recent blood loss. That's why a proper medical evaluation is always required.
Saline ozone therapy uses ozonated saline infused intravenously. A key advantage of this technique is that it maintains the concentration of ozone throughout the entire infusion. This allows us to deliver a stable and consistent final ozone concentration, which is one of the reasons why saline ozone is actually one of the most effective forms of ozone therapy. Unlike blood-based techniques, saline ozone does not require heparin, does not involve blood extractions, is gentle and safer for many patients. It is especially useful for patients with anemia, recent blood loss, post-surgical recovery, vascular limitations, or when we need reliable and sustained ozone exposure. Saline ozone is not a weaker therapy. It is simply a different way of delivering ozone effectively.
EVO is the most intensive ozone therapy. Blood circulates outside the body through a specialized system where it's filtered, oxygenated, and treated before coming back into the body. Like major autohemotherapy, a small dose of heparin is required during the procedure. Because of this, EVO is contraindicated in patients with blood coagulation disorders, recent surgery, anemia, recent blood loss, cardiovascular disorders, and vascular limitations. EVO can be powerful, but it's only appropriate for carefully selected patients under strict medical supervision.
All ozone therapies are effective when matched with the right patient and the right clinical situation. More intensive doesn't mean better, and gentle doesn't mean less effective. What truly determines the effectiveness is the ozone concentration, because ozone concentration determines the dose, and the dose determines the biological effect. Depending on the concentration used, ozone therapy can act as an immune modulator, reduce inflammation, and support metabolic balance, or at higher and carefully controlled concentrations, induce reactive oxygen species that can promote apoptosis in abnormal cells. That is why saline ozone is not inferior. By allowing a stable and sustained final ozone concentration, it offers a precise control over dose, safety, and therapeutic effect. The goal is always the same: personalized treatment, safety, and meaningful clinical benefit.